everyone, and welcome to our Monday Minute. Today we have a lot of information to cover as November 1st brought about the release of the home health final rule that was quite voluminous. There were several changes, the most important to many readers being the rate adjustments. CMS had originally proposed a behavioral adjustment of over 4% to the home health base rates, which was going to plummet our rates substantially. In the final rule, they have made the behavioral adjustment a negative 1.975%, that offset by a net adjustment to the inflation factor of 2.7%, therefore a slight increase in our payment rates at $2,057 and some cents. That adjustment was quite surprising as we were very concerned that it would be finalized at the 4% that had been proposed. But very grateful, honestly, that it was changed. This cannot be considered a win of the war. It is a slight battle that we have overcome, but please make sure you pay attention to legislative information that requires your advocacy in order to continue to rid ourselves of those rate changes they continue to implement. The LUPA rates have all been increased based on the 2.7% inflation factor. They are not subject to the behavioral adjustment. The outlier fixed dollar loss ratio has been dropped from 27%, what it is today, down to, or the factor has been changed up to 35%, but that means an additional 8% in excess cost will have to be absorbed by an agency before the outlier payments will kick in. The case mix weights of all 432 HIPS codes have been recalibrated based on the 2023 claims data. This means that some of your HIPS codes that you typically utilize will see changes in their case mix weight. Some could be up, some could be down. They also have looked at 2023 data to adjust the therapy thresholds associated with those 432 case mix weights. Only 8 of them were changed, and 8 of them did have a decrease of 1 visit, which is very good for agencies, which it basically means that if the LUPA threshold for those 8 case mix weights today in 2024 was 4 visits, it will now only be 3 visits in 2025. So that was definitely a positive change. There were changes to numerous pieces and parts of the functional calculation portion of the PDGM HIPS code. You need to pay close attention to your low, medium, and high rankings in the calculation of the functional scoring to ensure you understand where those percentages lie and where those calculations will take you for the 2025 payment rates. With the low and high comorbidity adjustment, the low comorbidity adjustment sees the removal of the respiratory category, where we will no longer have access to the COVID-19 and related diagnosis being a low comorbidity adjustment in 2025. And the high comorbidity adjustment categories have dropped substantially from over 100 down to just over 90 high comorbidity case mix groups for 2025. In addition to rate adjustments, the value-based purchasing model was finalized with changes for 2025 last year. The only thing in the current final rule that affected value-based purchasing is the elements that they are proposing to possibly include in value-based purchasing in 2027. So you'll want to make sure to read through those and comment if you so choose. The Home Health Quality Reporting Program brings about the finalized requirement for you to submit OASIS on all patients, regardless of payer, beginning July 1st of 2025. In addition, they have finalized 4 new measures for the 2027 implementation, including items related to social determinants of health, food issues, utilities, and they are updating the transportation item that is already present. With the quality reporting program, they have also proposed some additional measures to possibly be included for the future. With the last item we're going to discuss today, there was a finalized change to the home health conditions of participation, which includes the requirement for agencies to develop and implement an acceptance to service policy surrounding how you are reviewing referrals and determining patients you will accept on service. They have also finalized that you are required at least annually to review the services that are being publicly reported that you provide and adjust that to any services you are currently providing if there are changes that need to be made. There are many pages of details surrounding the home health quality reporting measures that they are proposing for the future. So whomever in your agency is on top of your quality data, they will want to make sure and review those. We do have a coming Alliance webinar for the home health final rule. In this Monday Minute, we will provide you the information for registering for that webinar. Thank you much for participating today. If there is anything Healthcare Provider Solutions can do to assist you with implementing this home health final rule content, please don't hesitate to reach out. Have a fabulous day.